morning, everyone, and thank you for joining us today. My name is Brooke Haynes, and I'm the Telehealth Education Coordinator for the First Nations Telehealth Network. Today, we are joined by John Sue from Indigenous Innovations. They offer a free service helping First Nations people access quality health care for feet, teeth, eyes, and medicine. They help with the paperwork, make suggestions on where to go, and guarantee that the client will be treated with respect every time. He will be presenting on breaking down barriers in healthcare for urban Indigenous. I would like to begin by acknowledging that we are on the traditional lands referred to as Treaty 6 territory, and that the participants of this session and all the people here are beneficiaries of this peace and friendship treaty. Treaty 6 encompasses the traditional territories of numerous Western Canadian First Nations, including Cree, Dene, Stoney Nakoda Sioux, Saulteaux, and Ojibwe. The First Nations Telehealth Network is dedicated to ensuring that the spirit of Treaty 6 and all treaty areas here today are honored and respected. For participants attending this session from video conferencing equipment, please keep microphones muted. For participants on Zoom, you are already muted. Questions can be asked verbally by using the raise hand function on Zoom or typed into the Q&A section on Zoom. We will also go roundtable to the communities on video conferencing equipment. We will keep questions until the end of the presentation. Just a reminder, this session is being recorded and will be on the publicly accessible First Nations Telehealth Network website. All registered participants to this session will receive an electronic evaluation after this session is over. We ask that you take a few minutes and complete the evaluation. Any and all feedback is appreciated. As I mentioned previous, we are joined today by John. The mic is yours.
Thank you, Brooke, for the introduction, and thank you everyone for attending this seminar about how we help First Nations break down the barriers to using healthcare. So first, I'd like to tell you a little bit about myself and my partner. So my name's John Sue, and I'm a co-owner of Indigenous Innovations. My partner is Adrian Beaverbones from the Ochis Band in Alberta. I actually work out of Vancouver, and Adrian is the person in Edmonton. So we've started last January helping First Nations with healthcare. Our corporate mission is to positively impact how First Nations are treated and experience the medical system. How we've done that is that we've created a seamless and innovative program that makes using the healthcare system for our clients simple and easy. We've assembled a group of medical professionals that promise us to treat our clients with compassion and respect every time. I meet individually with every single one of those medical providers, and we screen the people that we actually refer to. One thing that the people that we work with, the number one criteria is that they want to positively impact the First Nations community and not just get rich off them. We essentially are the advocate for our clients so that they never get mistreated, lied to, or discriminated against. Some of the unique programs that we've created here in Vancouver, our flagship program is the Indigenous Innovations Get Fit program. That program is all about getting healthy, and we give away cool, fun stuff to get healthy, such as a free pair of shoes, a tablet, gift cards, wireless speakers, phone minutes, bus tickets, just small little things. It's not going to change anyone's life, but it's fun to get, rewarded for getting healthy. And all our clients have to do is really get healthy. So to do things such as get your yearly checkup, get your teeth cleaned at the dentist, get your eyes examined, or join any of our programs that are related to feet, teeth, health, or medicine. Another program that we've created is the First Nations Nasal Narcan program. And the reason why it's called the First Nations Nasal Narcan program is because it's our First Nations Nasal Narcan program that is driven by our clients. Without our clients coming together and collaborating and helping drive that program, this program wouldn't exist. So that's why we call it the First Nations Nasal Narcan program. And for those of you who aren't familiar with what nasal Narcan is, it's basically a drug that stops someone from overdosing and saves their life. And some of you may know that Vancouver has a major drug problem, especially in the downtown east side. So this is the nasal one, where it's as simple as just putting it, up someone's nose and then spraying it. Where the needle naloxone, which most people are probably used to, is where you have to actually suck it out of a needle and inject somebody. So the nasal naloxone is way easier to administer, saves way more lives. But the only thing is, only First Nations gets that for free, because it's actually quite expensive. To buy that, if you're not First Nations, it's about $180 per 2 doses. But our First Nation clients get it for free, and what we do is they bring it to us for us to give to the community. So our clients are really proud of that program, and I think it's making a huge difference, because we supply 7 Indigenous buildings in Vancouver. The Tsawwassen band medical team gets nasal naloxone from us. We also supply an outreach team in Kelowna with nasal naloxone. If you think about what's happening with COVID-19, there's a bigger pandemic that many people don't know about, and it's the opiate pandemic, which the record number, 170 people died in 1 month. That drug pandemic is killing way more people than COVID is. So that's the pandemic no one's really talking about. A unique program we're putting the final touches on is our First Nations Seniors Healthcare Program. We're in the final stages of finishing that off, but basically what that is a program that pre-packages any useful items that an Indigenous senior would need in their later years. And it's done so simple, where we're consulting with our medical doctors to say, what are the most useful items that Indigenous seniors need? We put that list together, and then we bring that list to our pharmacy partners to say, these are the items that our Indigenous senior clients need. The pharmacy will put those packages together and have them ready for our Indigenous clients to pick up or to have them delivered. It's that simple of what we're doing, is we're trying to help the Indigenous seniors get access to basic stuff that they're going to need in their later years that make their life more comfortable. Especially if status pays for it, why wouldn't they have it? Right? I think that's the toughest thing, is when I talk to a lot of our Indigenous seniors, there's so many things that would make their life easier that they don't even know exist or how to get it. And the last thing that we've done as a company is we've created a 1-page over-the-counter medications list for our clients. And over-the-counter stuff is just stuff you buy on, over-the-counter. So like Tylenol, Pepto-Bismol, allergy medications, vitamins, skin creams. Most of our clients don't know that First Nations are able to get those items for free. A lot of them are quite shocked, and a lot of them have been told the wrong information. A lot of them believe and have been told that, no, you got to pay for that, it's not covered, which is absolutely not true. So when you think about what are we doing for First Nations communities that other medical offices, pharmacies, and nurses and doctors can't do? All of these things, are things that are missing in the system. And the reason why we can do things that other medical professionals and offices can't do is because we're a private business and we are not tied down by the bureaucracy of the system. We've gotten back to the roots of people helping people. One of the biggest complaints I hear from medical professionals, off the record of course, is that their hands are tied by the bureaucracy of the medical system or their professional association. They can't help people because that's not the way the hospital or the medical system does things. How crazy is that? You can't help someone because that's not the way they do things? We see it all the time, how the medical system is more about egos and not getting sued than helping people. Today's seminar, it'll be about 30 minutes. I'll talk about 3 things. 1, what are the barriers that our clients are facing? 2, what we as a company, Indigenous Innovations, are doing to break down those barriers. And the last thing is, if what I say today on this seminar makes any sense to you and you want to know more, how to contact us and the next steps. The last 10 minutes of this teleseminar will be reserved for questions and answers. And if you do have any questions and answers, please send them in the video chat or send a message or wait until the end and I will answer them all. I just want to kind of get through this information first and then, save extra time for any questions because, I want to respect everyone's time and I don't want to go over time. So what are the barriers that our clients are facing? We've been in business for about 1.5 years now, and what we've discovered is these following barriers. 1, they don't know specifically what's covered by their status. 2, they don't know the process on how to get it. And the third one is kind of a combination of 3 things. It's communication, psychological, and racial barriers. So our first barrier, most clients don't actually know what's covered. They all know that they get healthcare benefits with their status, but they're kind of left with, what is it? So often our clients are confused, frustrated, and disappointed. They're confused because the government documents that explain everything use medical and complex names for items, and there's way too many steps in that whole process. They're frustrated because if you've ever called NIHB or Indian Affairs, you're on the phone for a long time, and most of our clients, don't have phones or don't have the patience to wait. 3, they're disappointed. How many of our clients have complained about getting the runaround or responses that they can't understand? But like, what did this doctor even say? The second barrier, our clients don't know how to get access to the health benefits, like the whole process, right? The steps on how to do things, properly by the system. Some of you may know you get vitamins, Tylenol, allergy meds, Pepto-Bismol, all covered by your status. But did you know only a prescribing pharmacist can do that for you? And that places like Rexall and Shoppers, most of them don't even know what's covered by status and then end up telling, our clients and First Nations, sorry, you got to pay for that. It's not covered. The process is confusing and frustrating. Things like long wait lists, multiple appointments, and the medical system, it just isn't Indigenous friendly. When I ask my clients about their experiences using the medical system, the responses are, I don't know what to say. Where do I go? Who do I need to talk to? Our clients have lost faith in the system. They feel forgotten, and they think, what's the point? How many of you know what your healthcare benefits are? Is it easy and is it straightforward? For some, maybe. For most of our clients, it's a big fat question mark. How many of you have experienced communication, psychological, or racial barriers using the medical system? So when I say communication barriers, our clients don't understand the words or what the medical professional is talking about most of the time. They know it's in English, but they're like, what the hell is this? What is this? What are they referring to? I don't even know what they're saying. Psychological. Our clients are intimidated to go into the business or medical office. How many people do you know are scared of doctors or scared of going to the hospital? The shame of asking a question, being asked a question you don't know the answer to. Racial. The stigmatization of being a drug addict, a drunk, or a thief, right? A lot of people don't want to tiptoe around this and say, oh no, that doesn't happen. We're professionals. We don't do that. That is absolutely not true. They just can't admit to it in public. Everything I've said, some of you may or may not relate to it, but from what our clients are telling us and from what I'm seeing myself, These are major problems. It's not a small problem, not a medium problem. It is a major problem. So what's our solution? What are we doing differently to break down these barriers? So the barrier of clients don't know what's covered. What we do to break that down is we break it down into common people language without the medical terms. So for example, we can help with feet, teeth, eyes, and medicine. Our clients know what that means. So if they have problems with their feet, their teeth, their eyes, and the medicine, they just ask us, and we find out how we can get it for them. Or if it's not covered, it's not covered. We can't change the system, not yet, but we can at least help our clients to utilize the system to its maximum, for its maximum purpose. It's there for people to use, not there to confuse people from using it. So how do we break down the barrier of helping our clients get access to it? We've made it so simple. We ask a few simple questions like, hey, what's your name, your birthday, your status number? What do you need help with? And let me find out if that's covered and how to get it for you. It's that simple. You got to provide just the basic information, what they need help with, and we'll find out for them if we can help them with it. And we get back to our clients the same day, if not a few days, if it's a complicated item. Usually our client experience, they're just happy. They'd be happy or lucky if anyone got back to them, right? So when we're calling them back in a day or in a few days, they're over the moon. They're like, whoa, this is awesome service. I've never had this before. But really, this is standard basic service. I tell my clients, this is not awesome service. It's wherever you've been going, you've been getting crap service. So we're doing a good job, a great job, but your previous experience is not acceptable. We would not allow that to happen. So this combination of three things, this last barrier is a complicated one: communication, psychological, and social barriers. So how we break down the communication barrier is that we become the hub of communication for our client. So if a doctor says something to our client and the client says, John, I don't even know what this doctor's talking about, we'll actually call the doctor and say, hi, I calling on behalf of this client. They said they don't understand what you're saying. Can you please tell us, what you want them to know? And we'll actually be in the between person to say, here's what the doctor said. Because I think a big challenge for most doctors is not using the complicated terms, and also the compassion of understanding the history of First Nations. I find sometimes the doctors they don't have the bedside manners, or they lack the compassion, and it's just about doing the job, and it just makes the client feel like not a person, and it just reinforces issues. The psychological barrier of going into a business. I never realized how big of an issue this was until I talked to my clients, because they said, oh, we've always walked by your store, but just never decided to kind of come in. We're just too busy. So what we did to break down the psychological barrier is we do outreach. We attend Indigenous events. We set up a table in front of our store so that we break down those walls to entry. So we are there, and we immediately notice a big difference. When we had a table on the front sidewalk, we had people coming up, hey, what do you guys do here? What can you do? Right? We bring the services to our clients instead of waiting for them to come to us. The third one of this trifecta, racial barriers. We are a non-judgmental organization, and I'm sure you've heard that all the time. And what makes us more non-judgmental than most other organizations is we have team members from the community. So they've been there, they've done that, they've beat recovery, they've beat alcohol. So they know where our clients are right now, and they can relate to the client. I think that's the number one thing. There's, oh, I feel sympathy for you, but you don't understand my situation, versus I have compassion for you and I've been there, done that. I know where you're coming from. If you get angry and lash out, or you don't understand, or you're confused, or you feel intimidated, hey, I've been there. Our team members have been there. They understand. So there's that higher degree of trust and openness to share and to say, hey, I need help. We don't assume anything. We're just there to find out what our clients need and how we might help. My partner, Adrian, and I have committed our lives to helping First Nations. We've helped hundreds of clients in Edmonton and Vancouver. We know what the problems are, and we provide simple and effective solutions that just help people quickly. The best compliment I get, maybe once a month or so, and it always makes me feel really grateful, is when our clients say, thank you for helping our people. That's a compliment above anything else that makes me feel proud and grateful for this opportunity to work with First Nations, is the opportunity to help the First Nations people. If what I've said makes sense to you today, sounds like something you'd like to share with your band members, you're probably wondering, what's the next step? What do we do next? And I think this is the key part. I could have said a bunch of things. I could promise the world, but the most important thing is taking the next step and taking continuous and consistent action to bring this to life. So what's the next step? 1, let's connect. Send me a message, send me an email, get in contact with me. Let's chat. Let's chat about what problems we can work together to solve. Right? There's so many ways we can do things, and it all starts with that conversation, that first conversation. Reach out or let us know how to get a hold of you. Put my contact information on your band website, your Facebook homepage, your band office, your resource listings. Send out to band members, letting them know we actually exist. I have so many clients say, oh my God, I didn't even know you guys existed. I wish you guys were around way before, years ago, because I needed this help, the communication, this link. And the last is kind of more a request than what to do next is, we are looking to partner with other Indigenous owned healthcare providers in Vancouver and Edmonton. If you know of any, please put us in contact with them. And we can do some amazing things together, change how First Nations in Canada are treated. We just got to get with the right people to make things happen. There's nothing new that we have to do. It's just the whole point of connecting with the right people, collaborating, and together we can do more with less effort. Be part of, Indigenous medical history, going out there and showing how working together with us and other medical providers, that we can do way more on our own together without the help of the government. The government put the tools out there. Let us work together to help our clients, our people, to fully utilize it and to fully make the best and stay healthy, right? If you just wanted to, or if you're still unsure of me and don't know enough about me, take a look on our Facebook page. So we have 2 Facebook pages. It's Indigenous Innovations YBR and Indigenous Innovations YEG. They're very similar, but because we are doing different stuff here in Vancouver because of the bureaucracy and the government laws, there's some stuff that is only on our Vancouver page. So if you only have enough time to check out one page, there's probably more stuff on our Vancouver page than is our Edmonton page. And I forgot, some unknown secrets about the medical stuff that we've learned with working with our partners. And it has mostly to do with the pharmacy. A lot of people don't know, even in general society, that a prescribing pharmacist in Alberta can actually do a lot of similar stuff that a doctor can do. So that's why only a prescribing pharmacist will be able to get you the over-the-counter stuff for free. A regular pharmacist who's not prescribing won't be able to do it for you, or probably won't even know. And it's probably just better not to go to Shoppers or Rexall, just because most likely, not always, they don't actually know, what these status benefits are. And a second thing is a prescribing pharmacist can do, as I've said before, can do similar things, not all things, like the doctor, like they can't write prescriptions for drugs. But one thing is, if you ever need a blood test, while you're picking up your stuff at the pharmacy, your prescribing pharmacist can write that form to get you a blood test. Instead of going to the doctor to get the blood test, while you're at the pharmacy, if you're at the pharmacy, ask your prescribing pharmacist, hey, I need to get a blood test. But probably the best thing for you to do is just talk to your prescribing pharmacist and say, hey, what other services can you do for me? And then they can tell you about all the stuff, because they'll know your medical history, everything else. So I guess we went over about 5 minutes, but now I'm just going to open it up for question and answer. We've got about another 5 minutes, and if anyone, I'm sure it's okay if we go over. So I'm just going to leave it now, Brooke, to see if there's anybody who has any questions that I can answer for them.
So for participants on Zoom, if you have a question, feel free to type it in the Q&A or raise your hand, and you can ask your question verbally. Okay, so I'm speaking to Dustin here. I actually don't know who's the supplier for the nasal naloxone. I believe there's only one developer for it, and the only reason I don't know is because our pharmacy partners order it. Our clients bring it to us, and then we just give it to the Indigenous buildings or to the medical providers. In Alberta, it's a little bit different than BC, because in BC, a client can go to the pharmacy and then they can get the nasal naloxone. Where in Alberta, you actually have to go through like a quick course, and then the pharmacist can give the First Nation client the nasal naloxone. But I have many videos and testimonials about how much easier and more effective nasal naloxone is, because nasal naloxone essentially, from what I'm hearing, it's a concentrated dose of the product that saves the person's lives. And all it is literally a little plastic, like the size of maybe a couple of loonies. You just put it up your nose, spray, wait for a couple of minutes, and then if the person doesn't come together, you take the other dose, which is in the same box, put it up their nose and spray. So it is super easy for our outreach workers to use. Some of our clients, some of them are, we're in downtown east side, so a lot of our clients that have nasal naloxone, they might be under the influence of drugs. They say it's way easier to use than to pull out the needle, suck the fluid into the needle, and then inject it. So yeah, we've had tons of success. Everyone that is, has used it praises, the nasal form. It's just in Alberta, it's more, the system has made it more difficult for our clients in Alberta to get it. But if you are interested in setting up your own, reach out to me and I can tell you how to set it up, connect you with the people on how to set it up, and I'd be more than happy to share our resources with you. Oh, great, Dustin. So I actually know some people at First Nations Health Authority. So I know James, Sally, Mr. Delorme. Yeah, we actually work a lot with First Nations Health Authority in helping our clients. A lot of the times I'm calling in there and just, that the nasal naloxone, as you know, has been a game changer in the downtown east side. So I think there's probably no more questions, Brooke. Yes, I think that is all for questions. Thank you so much, John, for being here with us today and providing this valuable information. Just a reminder, this video will be on our website. So if you know someone who would benefit from it, feel free to share it. It should be posted sometime later today or tomorrow. And for all registered participants, you will receive a survey to fill out. It would be very helpful if you just took a couple minutes and filled out that survey. And is it okay if I leave my number real quick, Brooke, and contact information so that people know? Yeah. So my name again is John Sue, and my phone number is
504-7016. That's my Edmonton number. And my email is indigenousinov@gmail.com. Would love to hear from someone. I would love to connect and collaborate. We're going to be doing some very impactful things for First Nations in Vancouver and Edmonton. You will see in the next year that we're going to take this program to the next level, and we're really going to, forever change how our clients experience and get treated in the medical system.
Great. Thank you so much, and everyone have a great Monday. All right. Bye-bye.
Thanks, Brooke. Bye.